are able to move it forward, but beyond this, they're not able to. Or, it's very painful. Or suddenly they say like, just starting, it is very painful, but after that, it is okay. These are the different set of muscles when it is affected. These people come with different complaints. Now, most of the time we do like for nerves assessment. Like that is what we do, but we need to understand that even when the range of motion is restricted, when people are coming with pain, we need to understand which muscle is, in fact, which muscle is affected. What are the groups there? We need to try the which range of motion is affected. We need to try to analyze which is the agonist, antagonist muscle there, and all that gives a very good understanding about the issue the patient is facing, right? So again, just the same concept. You have the stretch reflex arc and the reciprocal inhibition. You have the nerve coming from the efferent impulses amplitude causes contraction of the, when it contracts the quadriceps, right? What happens? It relaxes the hamstring group, right? And the vice versa, when it contracts the hamstrings, it relaxes the quadriceps, right? And this is what happens in stretch reflex arc. So another important thing, like I said, is skeletal muscles. They work together to create and reverse movements, right? So uh, you need to understand that when like I said, when for a flexion of the elbow, there is biceps that contracts and then the tricep relaxes. Again, there is a video which will talk about all this.
No audio, sir.
Not audible, sir.
Now, when you look at how the muscular system moves, you got to keep two things in mind. First, muscles never push, they always pull. Now, since Claire here is obviously pushing herself up, well, remember that most skeletal muscles extend over joints to connect to at least two different bones. That's why they're skeletal. When a muscle contracts, the bone that moves is called the muscle's insertion point. And the muscle brings the insertion closer to the bone that doesn't move, or at least moves less, and that's called the muscle's origin. And that movement is always a pull, with the insertion bone being drawn toward the origin bone. And when you think about it, it has to be this way. Muscles can't extend themselves beyond their resting state to push a bone away from it. So even though Claire's pushing herself up off the ground in an exercise we call push-ups, her muscles are actually pulling their insertions toward their origins. When she pushes herself up, her pectoralis major is contracting, pulling its insertion point, which in this case is the top of her humerus, toward the immobile origin, which is her sternum. Every single movement that your skeleton makes uses the very same principle, whether you're hammering on an anvil or lifting your pinky to sip a cup of tea. So that's the first thing. The second big thing to remember about skeletal muscles is that whatever one muscle does, another muscle can undo. You can generally classify skeletal muscles into 4 functional groups depending on the movement being performed. For example, the muscles that are mainly responsible for producing a certain movement are called that motion's prime movers or agonist muscles. So with Claire jumping jacks, she's using those pectorals in her chest and latissimus dorsi on her back to adduct her arms back into her sides. Put another way, those are her prime mover muscles for adduction. At the same time, there are antagonist muscles that are working in reverse of that particular movement by staying relaxed or stretching or contracting just enough to keep those prime movers from overextending. So in this case, the antagonists of the jumping jacks would include the deltoids on top of her shoulders, which among other things help her slow down her arms so that she doesn't slap her thighs too hard. But when it's time to start abducting her arms from her side to over her head, those deltoids now become the primary movers, while the pecs and lats switch to being antagonists. The third functional muscle group is your synergists, and they help the prime movers usually either by lending them a little extra oomph or by stabilizing joints against dislocation. With all these arm movements, most of the rotator cuff muscles, like the teres minor or the infraspinatus, are acting like synergists. So this is how skeletal muscles are functionally grouped. But what about their actual
Okay, so I hope you understand. You understood. So basically, what they're trying to say is that how a muscle works. The two rules are muscles never push; they always pull. Right. So what it means is the origin, insertion. Right. The function of a muscle is to pull the insertion point towards the origin. Okay, and what one muscle does, the other muscle can undergo, which means that when one muscle acts as suppose for a flexion of the elbow, you have the primary movers, it contracts. Now for this to relax, this muscle cannot really do anything, so what it does is that the triceps contract, only then the biceps relaxes. So that's a concept that we need to understand, right? Next, we are talking about we have the picture of the sarcomere contraction. We will be I'll be sharing those videos, so you just need to go over and over and again, at least a couple of times in so you will understand what we're talking about. Refresher of the basic is very important to understand what exactly is a trigger point, right? And we need to understand how a muscle works, because it is not always easy to remember the name of these specific tests that we say for muscle, of a function of a muscle, to test a muscle. But what we can always see is we can understand which muscle is involved, and then try to do the test for that particular muscle based on these principles. So it is important for us to understand the origin, the insertion of all the muscles, and once you start completing one particular area by area, we will be able to refresh the whole thing in the body. So trigger point characteristics. Now, pain often is exquisite and is present at a discrete point. Now, the pain, how do we differentiate if it is a trigger point, if it is a muscle tear, or if it is just an inflammation, or any other kind, if it's something like a cancer, all those things, because you cannot say that all pain is a trigger point. So how do we differentiate everything, right? Uh, a nodule is embedded within a taut band in the muscle. Now, I hope you remember when I said that there is a sarcomeal contraction that is happening. You saw that video, and when that sarcomere contracts, for some reason it remains stuck together. And what this does is it forms a nodule, right? And sorry about that. So what it does is it kind of sticks together. It forms a nodule, and then leads to the formation of what is called as a trigger point. And when you press that nodule, when you identify these knots, The pressure reproduces the pain symptoms with radiations in a specific map, right? So every trigger point has a pain map, and that is the brilliance about trigger point. And what it does is when a patient comes to you, you identify the trigger point, you see for trigger points, and when you try to feel the trigger points and when you try to press it, the patient will feel a pain. Suppose if it's for a sternocleidomastoid, and when I press the trigger point, sometimes the pain is on this side, right? And what happens is when you get a pain on this side, the patient will tell you, sir, that is the exact pain that I get in when I am in this certain position, or that is the pain that I get. So that what that does is you are right on target. That's the best part. So we can reproduce the pain symptoms, we can reproduce the exact symptoms that the patient is telling, right? And the pain cannot be explained by findings from a neurological examination. And here is again why it is very important for us, why it is so relevant. Any sort of investigations, any sort of examinations will not tell you that it is trigger point related, because it cannot be identified in an X-ray, it cannot be identified in a USG, in an MRI, in a CT, nothing. And patients will come with you with normal findings in all the reports, and what it does is that, and still they tell you that they are not able to lift their head, or they're not able to move, and they have a real issue. And I've had patients like they have gone to a lot of doctors, and they come to us crying, saying that doctors are saying that it's a psychological problem, that when I'm saying I have pain there, they don't believe me, because they've already given all sort of medicines, they've already given all sort of painkillers, they've given they've tried everything, right? And I still have pain, and when they tell them, they're not willing to believe. And I've actually seen quite a few instances where the patient come and cries to us, and they show us this letter from a doctor who's actually referring her to a psychiatrist, because she's having this much pain. So, and this is very, very something that we as doctors, we should understand about, and because this is very common in the society today. And with the lockdown, with a lot of jobs being done online, with a lot of continuous sitting, with a lot of work being done in a fixed posture, you know it is very, very essential that we understand what it is. Otherwise, it will be very difficult for us to help our patients. And it may induce autonomic changes as well. So what it does is that, when there is a trigger point formed in one muscle or one muscle area, what it does, it will spread to the other muscle fibers as well. And the entire muscle, it will get stuck, and, there will be stiffness in that muscle, there will be stagnation. And I will be using the word stagnation a lot, because this is exactly what it does. It will just stick together. It will inhibit the movement, the microcellular, circulation. All the lymph drainage, everything will be affected, and there'll be a lot of inflammation in that muscle. So here is another video. Again, this is also from YouTube.
Problems. Very few people know that these problems are often related to trigger points. Understanding and treating trigger points helps to lessen pain and improve overall health. This video is a short explanation and introduction to the trigger point. A trigger point is a small muscle contraction which can be felt as a small nodule. Pushing on this nodule is very painful. Trigger points can exist in each muscle of the body. Multiple can exist at the same time. Often both sides of the body are affected equally. The trigger point keeps the muscle tight and weak, restricting the muscle's range of motion. The trigger point can actually cause pain, or it can cause no pain unless touched. Mostly this pain is sent to a different area of the body. This is called referred pain. Referred pain can make finding and treating trigger points difficult. Luckily, referred pain follows typical patterns that have been well documented. Let's take a closer look at the trigger point. Trigger point lies in a taut band. A taut band is a tight strand of muscle that feels like a cord, easily mistaken for a tendon. The trigger point itself can be felt with the fingertips when its location is superficial. The size varies from a pinhead to a pea. When we continue to zoom in, we can see the muscle fibers that make up the muscle. The lines on the muscle fibers represent sarcomeres. Millions of sarcomeres, acting like tiny palms, have to contract to create movement. Sarcomeres can become overstimulated and unable to release their contracted state. This knot of contracted sarcomeres shows a segment of the fiber that has become shorter and wider because of this. But also a different segment now becomes stretched by this tension, shown by the greater distance between the sarcomeres. Together, multiple of these sarcomere knots form the trigger point. The stretched segments of the fibers give tightness to the taut band in which the trigger point lies. When sarcomeres are stuck in contraction, blood flow stops in the immediate area. The resulting oxygen starvation and accumulation of waste products irritate the trigger point. The trigger point responds by sending out pain signals. In return, your brain will stimulate you to stop using the muscle, which further shortens and tightens up the muscle. Trigger points will not release without proper treatment. The most effective way to treat a trigger point is applying a deep stroking massage directly to the trigger point. This can be done without the help of others. Deep stroking massage means performing a series of deep strokes across the trigger point nodule. In this example, a rubber bouncing ball is placed between the body and the wall to reach the trigger point in the lower trapezius on the back side of the body. You can see the ball moving slowly and deeply in short strokes from one side of the trigger point to the other. Series typically consist of about 8 to 12 strokes and are performed about 5 to 10 times a day. By using deep stroking massage, you are milking the trigger point, so to speak. Blood and lymph fluid is moved out containing waste generated by the contracted muscle fibers. Each time you move over the trigger point and release the pressure, fresh blood immediately flows in, bringing fresh oxygen and nutrients. It may take several weeks to return the muscle fibers to their normal state and fully release the trigger point. Trigger points which have existed for a long time will take a lot of treatment, but often results can be achieved in days, meaning less pain and improved mobility. You can find references to more in-depth information about trigger points and their treatment in the video description below.
So I hope you were able to see it. Again, we will be sharing this video in the group itself. It's a YouTube video. I'll be sharing the link. So just so this is what is more important, when we understand how it is formed here. So when a trigger point is formed in this area, somewhere in your trapezius, in your lower trapezius, right? What it does is it will show a pain which is somewhere here. This is the most interesting part, right? The problem is here, but the pain is here. And this is the most interesting part of trigger points. The issue is one side, and it shows a pain map, which is again away from the site of injury or the pathology as such, right? So you can see different trigger points here. You have the infraspinatus, supraspinatus, and say it's showing on the deltoid, right? And the anterior side, it's showing on the anterior deltoid and how it's radiating to the arm, right? You're talking about a trigger point in the back, which is showing symptoms like this, right? A trigger point in the scalenes, very, very important in our practice, right? And I hope you remember that video where that person was showing all that kind of directions. And, this is what patients will come to us. Doctor, I have pain here, and since if it's on the left-hand side, and always people, mistake it for some kind of angina, and they're always very scared. So this is the sternocleidomastoid, and you can see how they trigger point, And after learning about trigger point therapy, there's very difficult, or I must admit that I really don't know what a migraine is, because every hello, okay, somebody just
Yeah, you can continue. Doctor.
I think somebody just on the mic. Okay, so and you can see the trigger point in the hamstrings in your semitendous. You can see it on the hamstring, and you can see it's radiating almost in the just below the gluteals, and you can see how the trigger points in the anterior side of your shin, it's actually showing pain in the ankle, or in the big toe. So this is the most interesting part, right? And like I said, how the muscle fibers combine together, and you can see the taut band, it is called, and this is the trigger point that lies within the taut band, right? And I'm sure, and you can see that this is how a trigger point is formed. This is the very basic, the actin and myosin filaments I said, it is within the muscle fiber, there is this sarcomere contraction, right? And you can see that when one fiber is contracted, the other fibers are affected as well, right? And then it forms a trigger point in that muscle fiber. So whole this muscle fiber becomes very tight and rigid like a string, and you will find a palpable nodule, and which is a specific character of the trigger point, right? And you can see the green indicates there is disturbance in the circulation, and there is inflammation in that area, and leading to pain and other difficulties, right? And the pain map, and after some times, the brain sends a message, and there is no a total restriction of movement in that particular area. And this is how we treat the trigger points. We will discuss about that when we talk about the treatment aspect of it. Now, so this is what the basic. Okay, so that's it.
Can be achieved in days, meaning less pain and improved mobility. You can find reference many people trigger point. Trigger points which have existed for a long time will take a lot.
Okay. So I hope there was a very 3 videos which will sum up for today's class. I think we will just wind up here for the first session on this module 2 on trigger points. I hope everyone got a very, very vague idea, at least what we're talking about. We are open for discussions. We're open for questions now. Don't worry about the part where you were not able to see the video, because I'll be sharing it right away. And if possible, I want you to go through the video a couple of times, again before the next session, which is on the day after. So any questions so far? Any experiences that you would like to say? Any cases that you feel that it could be because of trigger points? Can you hear me? Am I? Yes.
So this is different from what we do in Marma therapy?
Slightly different, yes, doctor. Because see, Marma. Okay, let's put it this way. Marma is more on the, what do you say, the subtle level, or it's more related to the prana or energy and those concepts, right? Whereas trigger point is that thing which is on a physical aspect, which is on the muscle, right? So I think initially everyone should learn about trigger points. Once you understand trigger points, then we understand about fascia and we see how disconnected throughout the body. And then as we practice more and more, we can see that how these trigger points are affecting emotions, how these trigger points are affecting the overall well-being of the patient, how these trigger points are affecting the systemic functions. And then when you learn marma, you will have a better understanding about all these marma spots. So incidentally, many of these trigger points, spots, trigger points, and acupuncture points, and acupressure points, and marma points, they all coincide in many areas. So it is not right to say that trigger point is same as marma, right? But yes, there are a lot of similarities, and you can get a lot of connections from about marma from trigger points. Anybody else? Uh, it's I'm sure it's quite early to say all this, but then do you feel that oh yes, I got a patient, I did not get an answer for that, but now when I think about it, this could be that, do you relate anything like that?
Sir, can you please repeat the question?
Like you got a patient, like probably in your practice, not now, earlier, and then he or she came with some pain, and then you did not have an answer to his condition, but after seeing all these videos, now you're thinking that, oh, probably it could be because of that trigger point. Do you feel that you got a case like that?
Yes. Many a times maybe manipulations or after manipulating even the pain aggravates. Many patients which were something like mm, some patient which come down with having a problem in D12, D11, D12 somewhere, or in D3, D4, and the pain is somewhere upstairs. Like just we saw in the video that was a pain in the trapezius area, and
Yes.
the patient is complaining of in shoulder or somewhere in neck. And in such cases, if we go in for manipulation or even manya basti as we do,
Mm.
like in Ayurveda, what we do is manya basti and locally snehan svedal.
Yeah.
Maybe pain still remains there in many a times
Yes.
if it's the origin is somewhere else.
Yeah, exactly.
Like even in heel pain, surely here fascia works in maybe that there are pain in neck and the patient comes out with the pain in heel, something like that.
Yeah,
Maybe
exactly.
trigger point may help there.
Definitely. Because it is that's what I said. You get all these connections that you see in the patient. The patient will tell you, doctor, I did this and suddenly I'm getting heel pain. Even you won't believe that, oh, how did this patient get a heel pain because of something else? Because we always think about locally, and for us, and to understand the concept of, like, I always say that, when you do about fascia, then you talk about murda thaila and all that, how improper murda thaila can lead to a heel pain. You need to understand what is that connection. There has to be some connection, right? A physical and anatomical connection. And just because the modern medicine doctors don't really know so much about, or they don't consider all this fascia and all these things, and they don't really believe in murda thaila. They don't say, applying oil on the head is just, nothing. You don't really have to do it and things. But whereas there are so many yogas in Ayurveda, in texts that we study for applying, selecting a proper mudra according to prakriti of the patient. So yes, you will get a better understanding of all that, once we finish this session on trigger points. The most important thing will be you can understand how to treat them properly in a correct manner. That is the most important aspect, because we are always considered about, if somebody comes with a pain or a tender point pain, what should we do? A strong massage? Should we do a light massage? For how much time we should do? Because Abhyanga plays a very big, important part in our practice. And, to do Abhyanga, we need to understand, we need to have in mind the muscle that is there, and then we need to do Abhyanga according to.
Sir,
Yes.
wait, do you think, like, I wanted to ask about shoulder impingements, whether MTPs are responsible for shoulder impingements cases also?
Shoulder impingement persons, yes, it can be, because impingement is a condition where the nerve gets, it's stuck between the bones, right? So what happens is, that's what I said. When you have the shoulder joint, we're talking about the supraspinatus, infraspinatus muscle. We are talking about the deltoids. Now, if there is a tightness in the what do you say, the supraspinatus, most probably it's the supraspinatus. Sorry. We'll be discussing it again, but since you asked it, I just give me a second. Okay. So here's a shoulder joint, right? I hope you can see it, right? So when you talk about an impingement, right? What happens is, the normal function is when you abduct, when you abduct a shoulder joint, right? The uh, this is this infraspinatus. You have the supraspinatus muscle here. What the supraspinatus contracts, and what it does, it kind of pulls the head of the humerus a little bit down, right? And then when the deltoid gets involved, it does the extension. But sometimes what happens is the supraspinatus is affected, maybe due to a trigger point or anything else. And what that happens is the initial sliding of the head of the humerus, or the initial pulling down of the head of the humerus, does not happen. What happens is, the head of humerus is sitting here, and the infraspinatus is not functioning properly. Suddenly the delta takes over, and then the uh, humerus, when you try to abduct the shoulder joint, what happens is, it kind of lifts, and there is chances of impeachment, or the nerve getting caught under the structure. So yes, it could be, it cannot be, but yes, it does play an important role in understanding if there is an involvement of a trigger point. Because if there is an impeachment, you analyze, you find out the structures, you find out the muscles around it, then you check for trigger points, and if there is a trigger point, you release it, and again come back and check for the range of motion. If it is okay, then it was because of the trigger point. But if you release the trigger point and still there is an impeachment, then it is something else, right? So you always have another viewpoint to look into a consideration, to look into a specific condition. I hope that answered your question.
Yes, sir. Thank you.
Okay. Anyone else?
Sir,
Yes.
sir, can you treat post-fracture cases like a pain after fracture?
Yes.
Can you treat it under trigger point therapy?
Of course, doctor. Because what happens is, this is where the brilliance of our science is. We feel that for pain fracture management, olden days or earlier days, it was a norm that we would do a bandage and we would always pour oil or some kind of dravyas into this bandage, and that was how we used to treat fractures earlier, right? In according in Ayurveda Shastra, that is how you're supposed to manage a fracture. But nowadays, what happens is when you do a POP, right? The entire movement of that particular joint is restricted. The muscle fibers within that, the POP, what it happens, it remains in a very particular set of, state, and there are chances, not there are chances, but trigger points will be formed in those muscles. And that is why when people come to us for post fracture, because what it does, I'll tell you, if somebody has a fracture, they go to an ortho, he'll take an X-ray, he'll do a POP, and then when you remove the POP, he'll advise for a physiotherapy. That's a norm. So the physiotherapist, he will, what he would do is, he would do some sort of like stimulations, and just to make sure that the range of motion is okay, right? He will do an active range of motion, passive range of motion, right? That's it. But when we need to understand that, the entire fascia, there'll be what is called as facial adhesions, there'll be trigger point that is formed, and people will be still in pain, right? And then when we do our therapies, we are able to give better relief to patients. So understanding trigger point is very essential when you treat post-fracture rehabilitation. It will help you a lot. That's what I mean. Anybody else? Any questions? I think we still have time. Or is there any part in the first session that you did not understand, that you need to probably have a look into time for that as well? A couple of minutes.
Doctor, is there any Purva Karma before this trigger point management when we practice it, whether we have to do any as you said, like any bandages or anything to smoothen the stiffness in the beginning, like that, anything like that?
No, doctor. It basically depends on the chronicity of the issue, the number of muscle that is involved. It depends on that. But otherwise, you can directly do a trigger point therapy. We'll discuss more about that. On the treatment aspect. But
Okay,
yes,
doctor. Thank you.
We don't really need purva karmas many a times.
So at any stage of the condition, also we can apply this treatment.
Exactly.
Okay, thank you.
The best part of trigger point therapy is we always do it considering the comfort level of the patient, and that's how it makes it a lot of interesting. But if the patient has a lot of issues and a lot of trigger points, it is a time consuming thing as well. So we need to accordingly choose what we have to do.
Okay, doctor.
Okay.
So we can do these, we can press these trigger points in each and every therapy of the Panchakarma also, you are saying.
Exactly.
Is it right, sir?
Yes, I would always suggest, try to include trigger point in the Abhyanga part before you go for any sort of Svedanas, because that way it's more effective. What you see, always what we do is, we need to release these trigger points and then do the proper stretching, right? So when we combine trigger point therapy along with our Svedana, like PPS or Patravachunapinda Sveda, etc., we get better results. We get faster results than how we normally get, right? Because we're going to be more specific on that area. We can find those trigger points, and as doctors, here is what the difference is. Like now, what happens is usually we have a therapist, and then we just it's more like a prescription, right? AB PPS, AB 7 days, PPS 7 days, and when the patient will do the therapist will do an abhyanga. Now, if he is a very good therapist, if he is very experienced and very skilled therapist, and then yes, there are chances that he will identify these trigger points, and then he would have had this idea of how to treat these painful knots, from his experiences. But not always will we get, people who are that experienced, yeah, and dedicated, right? So they just blindly follow these steps. They look into the mirror, sorry, the clock. 45 minutes of abhyanga means 45 minutes of abhyanga. That's it. Yeah, but what happens? Yeah.
Sorry, pardon. Sorry, I want to say that is it helpful for the people who are healthy and they are taking the therapy of this panchkarma? And you meant to say, I meant to say that he's taking session of abhyanga.
Mm-hmm.
And is it helpful to the healthy persons who are taking the abhyanga also? We can guide our therapist that press these points. This is more helpful, and this in future it is better for him.
First thing, I would suggest doctors not to teach all this to your therapist. That is rule number one, because it is only if the therapist really understands the proper anatomy can we teach trigger point therapy to them, right? But I would suggest that we as doctors, we identify the trigger points, we do the trigger point therapy, and then we forward the patient for abhyanga and the other sneha sweda karmas to the therapist, right? So what it does is that the patient is more confident about the doctor, right? In practice, what happens is these people, they come to our clinics for some treatment or abhyanga, and then they see the therapist is really good, and then the patient will directly ask the therapist, "Do you do house visit? Can you come to my house? I'll pay you more." and
You are right. You are right. You are right.
yeah,
It
and this
happens
is what
many
happens.
times.
Yeah, many times, and and as doctors, we are dependent on the therapist, and we sometimes we just keep quiet, but then if there are certain things that we doctors only know, and then and the patient will be like, okay, so this doctor is specialist in that, so and I need to go to him, and he is an expert in that, and you get that bond, and also the therapist also is like, oh, he knows something, so there are things that I still don't know, and so everybody has that position, and it's a cool, it's a smooth thing to work for. Otherwise, it's a case everywhere. You like you charge 1,500 for abhyanga, and the patient be like to the therapist, "See, I'll give you 1,000. Come to my house and do it for me." And therapist would be like, "Of course, what's wrong?" And this is what happens. But when we doctors are doing it properly, when we understand, the patient will not take the chance of going to a therapist alone. That's the whole idea.
But actually, my question was that is it helpful to the healthy persons?
Yes, I
Or
was just going to
yeah.
yeah. So the thing is, we need to understand that if that person is having a trigger point, only then we have to do a trigger point therapy, right?
Right. Yeah.
No matter what you do, if there are healthy people also, there will be, right? That's the most interesting part. However healthy that person is, there are specific posture that his job demands. Like, he might be going to the gym, or he might be doing yoga every day. He might be doing everything properly. But then when he does that, he has to go back to the to the computer. He has to sit for some time, right? and he will develop these trigger points in these specific areas which is responsible for your
Always
posture.
remain contracted. Exactly.
Yeah, exactly. So uh, that's what I said. Trigger point is present in almost 85 to 90% of the individual. And those who do like proper yoga, those who do like Abhyanga every day, they can manage it for some time. But still, end of the day, you need it because, like I said, especially for the past 1 year, everybody are sitting at home, everybody are working from home, and most of them do not have a proper sitting posture like how they have in the office, right?
Exactly.
and
Exactly.
and we need to analyze all those postures. We need to break it down according to the muscle, and then when we treat it, we can give better results. And that's the most interesting part. I always stress on this, uh, trigger point therapy. You learn about osteopathy, you learn about chiropractic manipulations, all these things. When an ayurvedic doctor does it, you know it is the best because our concept of what do you say, shofahara, our concept of pittahara, our concept of amahara, all these medicines along with these therapies like abhyanga, ruksha, sneha, so all that when combined, actually the patient gets the best results. So you can actually challenge, and earlier in my practice, not just in my practice, when you come out of college, like, in Kerala, we don't really practice, or we're not allowed to prescribe modern medicines, even if it's for pain, like simple painkillers we cannot give. So we are always believed that, we are always have the disadvantage because we cannot manage pain. We don't have painkillers. That's what the thing in our mind is. But now, after so many years of practice, and after I've done all this in trigger point therapy, I can strongly say that now painkillers are not effective in managing pain, especially in myalgia conditions. That's a fact. And you need to apply all these kind of therapies, and you will learn it by yourself in your practice how effective these are.
Does it work instantly, sir?
Almost instantly. That's the best part. The patient will come to your room. You will identify the trigger point in just 3 to 4 minutes. You just release it and go back, and the patient is like, you know, oh, the
Great.
doctor has got miraculous hands. That's a feedback you get. It's very
Very good.
interesting. It's something which is very simple. It has been there all the while, and we never know the actual truths. And I've got like remarkable results in when you're talking about like vertigo. I've got great results in clogged ears. Like, people say, the ear is always clogged, and, they cannot, the hearing is affected. And it's mainly due to this, the sternocleidomastoid. And, I take the history, and then when I release it, and the patient is like, wow, my ears just opened. And I'm like, I didn't do anything, but that's the kind of thing. And you get kind of these feedbacks when I was doing these offline workshops as well, because you will do a demonstration on a doctor who's attending the workshop, and then he will give you the proper suggestions. Like, that headache that say just released it, clogged ears, and lot of many results, and it's always instantaneously. So when you get these direct, simple areas, you can do it just in one sitting.
Thank you, sir.
Recurrence of pain.
Recurrence, again, doctor, we have to apply the concept of Nidana Parimarjana again. That is exactly what our Shastra talks about. The recurrence only happen, so when you identify the trigger points, we need to also identify the reason for the trigger points, right? That is also very important. And we need to educate. If the reason is because of his improper posture, we need to educate him about proper posture, right? And we need to advise him to do proper stretches in that area, exactly. Otherwise, there is no recurrence, there is no chance of recurrence. We need to find the nidana of that issue, and then when we educate the people, and it doesn't come back.
Sir,
Yes.
to do the Abhyanga effectively, we need to understand the fascia correctly, right?
Yeah, exactly.
The distribution. So, sir will be taking, or from where we can acquire that, any books or anything there?
I'll be sharing a book. There is a book called Anatomy Traits. I'll be hopefully in this module 2. We'll be covering about trigger points, and I'll be dealing with mainly the cervical, upper back, and that is all possible in these 4 sessions. We'll be dealing on this area, and probably later on, we will talk about the rest of the areas as well, as the time permits. Because the first idea is to try to get this, idea of trigger points into everyone's mind, and you start practicing it, and you try finding results, if not in all throughout the body, but the major complaints out of there. That's why you just chose this, right? So I think the place to begin with is trigger points. Try to be thorough with these methods. Try to be thorough with these, try to understand about the body, how it responds to these therapies, and then connect it to the next level. So, and that way we can actually do it.
Okay. Thank you.
Yeah. Many doctors who have attended my workshop, the people who have been, what do you say, helped, the people who have really been successful, are the doctors who are actually working abroad, because there you are always restricted about the medicines that you can prescribe. But when you do all this, for pain, etc., people are, many doctors say that, their practice really improved when they started applying trigger point therapy. So, that is something that we can all do even today. We don't have to. People are suffering from pain. People have these issues. People need to be educated about a lot of things. And, once we understand these concepts and once we educate them, it will be good for us and as well as for the society as a whole. Any more questions?
One question in the chat box. It is: is it useful in acute conditions like sprain?
No. Sprain itself is a condition which is not a trigger point. So, no. But, acute condition or acute sprain, it is a sprain. So it's not a trigger point. So you don't apply a trigger point therapy when it is not a trigger point issue. Any more questions in the chat box? But I must admit, this has been a great session. So many questions, and I'm really happy because it's when people are responding, it really shows that okay, it's people are understanding, and they're asking questions and they're interested. So that's really encouraging, actually. Because, like I said, online workshops, it's very difficult, and when it is interactive, it makes it all the more interesting. Dr. Jasur?
Yeah.
So have we? Is there a Telegram group? Is there? Have we started for this?
Yeah. The Telegram group is started, and Facebook also we started. I think we'll share the links.
Okay. For the 3 videos that I did today, it is from the YouTube link, so I can share it on the Telegram itself.
Yeah.
I mean, and you can just post it on Facebook also if you want. So it's not big.
Yeah.
Because they can be it's convenient. They can, if they want to just from the group itself, they can do it.
Yeah. So I think we can wind up.
Yeah. Okay.
Okay. Thank you. Thank you, sir, for the session.
Thank you, sir. Thank you.
Yeah. Thank you. Thank you. Good night, and I'll see
Thank
you
you,
all.
sir. Thank
See you
you.
after. Yeah.
Good
Good
night,
night.
sir.
Good night, all. Yeah.
Both of you, sir.